Is a liver biopsy always necessary to diagnose liver conditions? Have you ever wondered if a liver biopsy is always needed to diagnose liver issues? The answer is no. A liver biopsy is not always necessary. While it is a reliable method to examine liver tissue directly, many liver conditions can be diagnosed using less invasive techniques. For instance, doctors often relying on blood tests, imaging studies like ultrasound, computed tomography, and magnetic resonance imaging, as well as non-invasive fibrosis scoring systems. A liver biopsy involves taking a small piece of liver tissue for examination under a microscope. This can reveal important details about liver inflammation, scarring, fat buildup, and even cancer. However, because it is an invasive procedure, it comes with risks such as bleeding and pain. Therefore, healthcare providers typically reserve it for situations where non-invasive tests do not provide clear answers or when precise disease staging is crucial for treatment decisions. For common liver conditions, like fatty liver disease, the initial diagnosis usually relies on imaging combined with clinical assessments and laboratory tests. These tests may include checking for elevated liver enzymes and considering metabolic risk factors such as obesity and diabetes. Non-invasive scoring systems, such as the Fibrosis for Index, can help estimate the severity of liver scarring and determine if a biopsy is necessary to confirm advanced fibrosis or cirrhosis. When it comes to diagnosing liver cancer, imaging techniques like multi-phase computed tomography or magnetic resonance imaging are often sufficient to identify key features of tumors. In many cases, a biopsy may not even be needed unless the imaging results are unclear or atypical. In summary, while a liver biopsy is an important tool in diagnosing liver conditions, it is not always required. Current medical practices emphasize starting with non-invasive methods. A biopsy is used selectively to clarify diagnoses, stage diseases, or guide treatment in more complex cases. This approach prioritizes patient safety and comfort while ensuring accurate diagnosis. It is always best to consult healthcare professionals for personalized advice regarding the need for a biopsy in individual situations.